Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 9 ineffective common treatment for lumbar radiculopathy that's used by a lot of healthcare providers. I will relate that to the normal healing cycle for the lumbar radiculopathy, so it will make sense why this treatment is not effective, and I also will leave a link underneath this video for the study support. I will also leave a link underneath this video for the study that indicated this treatment is not very effective. So lumbar radiculopathy, we need to understand the normal healing cycle. I'm going to use external paper cut for visualization, but the same process happens internally when you have lumbar radiculopathy, but we don't see it because the skin covers it. So for any musculoskeletal injury, especially lumbar radiculopathy, the body has to go through those 3 stages in order to heal. So the first stage, inflammation, swelling, redness, the blood starts to rush to that area as you see it in this image. The second stage of healing is a proliferation stage. That's when your body starts to build fibrotic tissue, scar tissue, and you can see it in that image. In the perfect scenario, actually during the maturation stage, your body starts to actually clear up everything from the proliferation stage and the inflammation stage. And when you have lumbar radiculopathy, usually the inflammation and the proliferation occur around this area that compressing on the lumbar spine, and then you start to have radiculopathy pain or radiated pain going down to your legs. For chronic condition, usually happen when your body going back and forth between inflammation and proliferation. So understanding this, when we start to look at the current treatment that used in healthcare system, it will make sense why these not actually very effective. So very common treatments, heat, ice, and when we look at the normal healing cycle, ice is temporary, decreasing inflammation, but it does not really provide long term, but it does not do anything to the proliferation stage and decrease in fascial restriction or muscle spasm. So the second thing that's used is electrical stimulation, which is actually cause temporary pain relief, but when we look at the healing cycle, it's not going to do much to the inflammation or proliferation stage. Very common that a lot of healthcare providers use foam roller or massage. And when you think about when you have inflamed tissue, that you keep rubbing on the wound on inflamed tissue, that will inflame it more, and that's not gonna break the adhesion, the fascial restriction, or the fibrotic tissue, because it's not targeting those conditions. The other thing that's used, and I will combine it number 5 with number 6, is acupuncture dry needling. So it's basically very small needle that's put in the back and around the legs area. And when we look at the normal healing cycle, that's not gonna really break the fibrotic tissue or the proliferation stage when you have adhesion in the back that's compressing on the nerve or inflammation. So it does not really affect the healing cycle very effectively. Very common used treatment is the joint mobilization, but when we look at it, is usually the problem with the soft tissue. But when we start to do mobilization in the back here and you have herniating disc, you might actually make it worse, because you're compressing on that disc, and too much mobilization could cause more inflammation, which is actually could make it actually worse. The other thing that very commonly used, and you will see it all over YouTube, and I don't recommend it to any of my patients, and I have not been giving stretches to any of my patients for the last 10-15 years because it does not work. It's actually make it worse. And I had a lot of patients watch YouTube video doing stretches, performance stretches, other type of stretches that actually had more symptoms than before doing those stretches. Please do not do stretching. So based on the study, actually stretching could cause more inflammation. So think about this way. Our muscles should act like a rubber band. When it contracts and relaxes, stretch like this. So when you have proliferation stage, which means you have fibrotic tissue in the muscle, it's like you have a knot in the muscle. So if you keep stretching it, you're gonna inflame it more, and actually it's not gonna release any of the fibrotic tissue and fascia restrictions. So please do not do stretching. The other thing that's commonly used is strengthening exercises, but look at it, the healing cycle. Your problem is proliferation and inflammation. If you overdo it with the strength exercises during the inflammation stage, you're gonna inflame it more. And when you have fibrotic tissue and keep doing stretching exercises, you might cause more fibrotic tissue. There's much more effective treatment than stretching. I do function training and correcting the body mechanic by body posture. That's more effective than the strengthening exercises that could cause more aggravation to the symptoms. If you have any comment or question, leave it in the comment section and I will answer it in a future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.